now come to the topic, is age a comorbidity which compels dose adjustment for DOACs? Your 60 seconds clap. In this clap, we will look at the available evidence for the following DOACs that require adjustments due to age. They are Apixaban, Dabikatran, and Edoxaban. For Apixaban, usual dose is 5 mg BD. Dosing guidelines recommend a reduction to 2.5 mg BD if it fulfills 2 out of 3 of the following conditions: serum creatinine more than 1.5 mg per deciliter, age more than 80 years, and a body weight of less than 60 kg. While there is a concern with regards to bleeding in the elderly, in the Everest trial, in patients above 75 years old, Apixaban has a lower probability of stroke and systemic embolism and no increased risk of major bleeding compared to aspirin. The trial followed dosing guidelines and demonstrates that appropriate reduction actually results in good outcomes. Moving on to Dabikatran, the usual dose is 150 mg BD. The reduced dose of 110 mg BD is supported for use in patients more than 80 years of age, with Japan adopting a younger criteria of more than 70 years of age. Even though it is not approved by the US FDA, it is approved by the European, Canadian, Australian, Singapore, and Japan regulators. A study by Mendy et al. Found that benefits of Dabikatran were found in both 150 mg BD and 110 mg BD groups. However, there was an association between age and treatment for extracranial bleeding. Hence, the dose of 110 mg BD is supported for use in these elderly patients. For Edoxaban, usual dose is 60 mg OD. Reduction to 30 mg OD is required for patients more than 65 years with at least one of the following criteria: weight less than 60 kg, concomitant use of potent PGP inhibitors, and creatinine clearance of less than 50 mL per minute. However, patients with creatinine clearance of less than 30 mL per minute were excluded from the trial. In the ELDER-CARE AF trial consisting of Japanese patients more than 80 years of age and considered to be inappropriate candidates for oral anticoagulants such as creatinine clearance less than 30 mL per minute, history of GI bleed or critical area bleed, or continuous or current use of NSAID or antiplatelet agent, very low-dose Edoxaban was superior to placebo in reducing stroke or systemic embolism with no significant difference in death from any cause. The generalizability of the dosing regime of 15 mg OD could be limited to just very elderly Japanese with the said criteria. In conclusion, there is a need to reduce dose according to each individual drug and patient characteristic. To help remember which needs to be dose adjusted by age, we can remember the dose reduction acronym of A, G, E for Apixaban, Dabikatran, and Edoxaban. This is a table for the dose reduction criteria for the 3 anticoagulants. For more information on the potent PGP inhibitors, you can refer to our DOAC cheat sheet. And that's the end of this class.